Good morning. I'm Pat Living with the Department of Health and Social Services, and I will be your moderator for the COVID-19 update for Wednesday, October 28th. We are joined today by Yukon Premier, the Honourable Sandy Silver, and the Yukon's Chief Medical Officer of Health, Dr. Brendan Hanley. Our sign language interpretation is provided by Mary Thiessen, and André Boursier from French Language Services Directorate will translate any questions from French-speaking journalists. Following our speakers, we will go to the phone lines for questions from reporters. We will call you by name, and you will each have 2 questions. Before we begin, I'd like to verify that everyone can hear us. If any of the reporters are having problems, please email ecoinfo@gov.yk.ca. Premier Silver.
Thank you very much, Pat. Hello again, everyone, and thank you for joining us today on the traditional territory of the Kwanlin-Dun First Nation and the Tahan-Quachin Council. Last week, we announced a cluster of 5 new cases of COVID-19 in Watson Lake. This brings our total case count to 22. Contact tracing is actively underway, and the source of the cluster continues to be investigated. Dr. Hanley will share more on this new cluster information in a moment. Since the first cases in Watson Lake were reported on Friday, my team and myself have been in touch with folks like the Mayor of Watson Lake and the Chief of the Liard First Nation. We've discussed how health officials are managing the situation and the extra testing capacity provided to Watson Lake to ensure that all those that are experiencing symptoms or may have been exposed can be tested. We also discussed the importance of accurate information when situations like this arise. I've said it before, but rumors travel very quickly and can cause unnecessary panic as well. Accurate, up-to-date information about the current situation is available, and it's available on yukon.ca. This is where you can find out about the active cases and the risk, if any, to the public. In this case, a public health notification was issued for Watson Lake. This occurred because of possible exposure at 3 locations in Watson Lake on certain dates. Now, I know that no community wants to be subject to a public health notification because it can cause an awful lot of stress and stigma in the community. Accurate information is extremely important to ensure that individuals can take the appropriate actions to protect their health and safety and that of their community. The last thing that we need is people worried about who might find out that they have COVID-19 and are not going to get the testing when they have symptoms. We also do not want people to worry about the impacts on their work situation if they or their employees need to be tested. If you feel sick, it's extremely important that you stay home. Use the self-assessment tool and contact 811 if necessary to get tested. There is no doubt that this will affect the workplace, but it is extremely important. We need to be patient as we continue to manage the pandemic. A paid sick leave rebate is available for employers and individuals who are self-employed. For those who may have been exposed in Watson Lake, if you have symptoms, even mild ones, it is important that you get tested. Now, back in August, when the residents of Dawson City, of my home, were advised to self-monitor due to possible exposure, it did cause a lot of concern at that time. In a lot of ways, it was an important wake-up call for our community. Now, we have been dealing with this pandemic for nearly 8 months, and it's easy to forget about the Safe 6 and fall into old habits, especially because we have such a low case count here in Yukon. Now, after Dawson City was notified back then, I saw residents, community organizers, and businesses all double down on precautions, making sure that they are doing what they need to keep themselves and the community safe. We each need to remember that the actions that we take, they're not just to protect ourselves. They are to protect our families, they're to protect our friends, our colleagues, our neighbors, our community. And believe you me, I know that it's easy to let your guard down. Just the other day, I was out for a beer, supporting a local restaurant, when I saw someone that I hadn't seen in a while. That person saw me as well, came over for a chat. Before I could say anything, the staff came over and very politely reminded us of the need to physically distance. So I want to thank the staff at Polarity Brewing for being so vigilant and ensuring that the Safe 6 are being practiced in their restaurant. It's so easy to forget, but incredibly important to remember. We all have a role to play in holding each other accountable. I encourage all communities across the territory to ensure the Safe Six are being practiced in all areas of the community. We're not out of the woods yet. Southeast Alaska and Northwest Territories have reported additional cases since last week, and we've seen the cases climbing still in British Columbia and Alberta. We've been very fortunate so far in this territory. It is largely due to the many sacrifices that Yukoners have made and continue to make. Our governments continue to support Yukoners and Yukon businesses through these challenging times and respond to their needs. We have been working with the mining industry to support them, to adjust their operations and to accommodate employees coming in from outside. Employees of Victoria Gold can now self-isolate at their Eagle Gold camp rather than in Whitehorse. This is part of Victoria Gold's comprehensive plan, which has been reviewed and endorsed by the Chief Medical Officer of Health. Yukon's mining industry has taken a proactive approach to ensuring health and safety are at the forefront of mining operations throughout the pandemic, and I want to thank them all for their efforts. Any individual or organization can apply for an alternative self-isolation plan. Information is available on yukon.ca. Those coming from outside of the BC territory bubble still need to self-isolate for 14 days, but there is flexibility around where that can happen. Earlier this year, we worked with outfitters on these kinds of plans to ensure that they could welcome guests as safely as possible while keeping Yukoners safe as well. We continue to engage with various sectors to ensure that we're responding to the needs of Yukoners and Yukon businesses. Various business support programs are still available, including the Business Relief Program, Yukon Business Relief Program. Last week, we announced an additional support to the tourism sector, and we'll have more details on that coming in the coming months. We will also be announcing additional supports for Yukon's aviation industry in the coming days. We are all in this together, and together we will get through this. I want to thank everyone for supporting local businesses and organizations. It continues to be extremely important as we navigate the pandemic, and I know how much it is appreciated. Businesses have had to make major adjustments this year along with individuals. I know it's not easy to continue to take precautions and to limit our interactions, but it is vital. It's vital for the health and safety of our whole territory. We have seen what happens in other jurisdictions when people let their guard down, and we do not want to see that happening here in the Yukon. We need to continue to practice the Safe Six, especially as we enter into the colder time of year when we spend a lot more time indoors. This week, our enforcement team laid another charge under the Civil Emergency Measures Act for failure to self-isolate as required. This brings the total number of charges to 20. We will continue to enforce the rules under CEMA to protect the health and safety of Yukoners. Again, a big thank you to our enforcement team for their efforts in keeping people informed about the public health requirements that are in place. If you do have any concerns, again, please contact our enforcement team at covid19enforcement@gov.yk.ca. You can also call 1-877-374-0425. Again, please continue to be kind and patient and respectful of each other. Practice the Safe Six, washing your hands, maintaining physical distancing, staying at home if you're sick, traveling respectfully, self-isolate as required, and also following the guidelines, including limiting indoor social gatherings to 10 people if they're not in your bubble. Halloween is coming up this weekend, and there are guidelines for all you ghosts and goblins, and that's available online at yukon.ca. Please have a look at them and make sure that your kids in your neighborhood are safe and you can enjoy this spooky time of year in a safe and responsible way. Please stay vigilant and do your part to support the territory, as I know you will, Yukoners. Thank you very much. Dr. Hanley.
Thank you. Merci, Premier Silver. Good morning. Bonjour tout le monde. I hope everyone is faring well. This has been a difficult week. Difficult around the world, difficult for Canada, difficult for Yukon, and difficult, most especially, for the beautiful town of Watson Lake. This past week, we received, of course, confirmation of 5 new cases of COVID-19, bringing the territory's total to 22, with our last 5 all being residents of Watson Lake. The 5 new cases are members of 2 family groups, and this is a cluster of cases, as all are in the same circle of transmission. None of these individuals has recently been outside of territory nor Watson Lake. We have many negative tests coming back from the contact tracing and testing carried out to date. And I want to thank all those people, whether in Watson Lake, elsewhere in Yukon, or even outside Yukon, who came forward for testing. This is so important as we try to make sure that we contain the transmission from affecting other individuals. The actual source of transmission is still unknown at this time, but our investigation continues. Of course, we would like to find the source, but it is also possible that we will not find how this particular COVID infection entered the territory. Given that we have tested a lot of people with symptoms around the Yukon in the last few days, I think we can say with some confidence that we are not finding evidence of ongoing transmission. Equally importantly, though, is that I urge anyone in Watson Lake with symptoms to get tested. We want to test as many people as possible to ensure that COVID has not escaped into the community. Remember that COVID most often presents with mild symptoms, like a cold might present. So even if you have a runny nose, a sore throat, a slight cough or tickle, please arrange for testing as soon as possible. This includes, of course, anyone who was in the exposure locations listed on the website, the motel and the 2 stores. But remember that our advice is for anyone, regardless of exposure, to be tested for symptoms, no matter how mild. This is how we will stay ahead of community spread. As I stated late last Friday, I named the community because we were calling out these exposure sites and wanted to make sure that anyone residing in Watson Lake or elsewhere that may have been in those locations came forward for testing. Yesterday, we did expand the exposure dates at the Bighorn Motel based on recent contact tracing to more recent days of possible exposure. So, to review the exposure sites, if you have been to one of the places of exposure during the listed dates and are experiencing any symptoms and you haven't as yet come forward, please do let us know and arrange for testing. And just to go over those locations again, in Watson Lake, the Super A, October 8th and October 16th, Home Hardware, October 7th and 10th, and the Bighorn Motel, October 9th, 7th through 9th, and 13th through 20th, and that's a change from the original dates of October 16th. The Watson Lake cases are another landmark event for us in Yukon as the first cluster of cases outside Whitehorse. This event should give us pause to reflect on what we can learn and how we can prevent or limit further episodes like this. First of all, these cases serve as a reminder of how quickly the COVID-19 virus can take advantage of every opportunity it is given to infect. If COVID had a goal, it would be to infect as many people as possible. That is basically what viruses live for, if you could say that they live, which technically they don't. Second, the Watson Lake experience shows something we already knew. We are no different from anywhere else in Canada, or in the world for that matter. After so many weeks without a case, it became easy to think that somehow we were impervious to COVID, that we could be more relaxed, not worry so much about keeping our distance from others, not let a few minor symptoms prevent us from keeping the business going or getting the workday done. Well, Watson Lake has shown us that we Yukoners are just as susceptible. The situation in Watson Lake could still get worse before it gets better, but it could also have been much, much worse. Think of someone who might have had COVID symptoms and then attends a party, a large wedding, a funeral, a store where protocols are not being observed, a workplace without proper sanitation and spacing. Watson Lake is just a small illustration of what can happen when we let our guard down. The only way you can prevent it is by ensuring that you're following the proper guidelines to reduce your risk. Here are some reminders from this recent exposure. Do not work while you're sick. Advise your employer and stay home. And employers, please send staff home if they're sick. Please immediately self-isolate if you have any symptoms. If you do have symptoms, get tested and follow the Safe 6. When we see after such a long time COVID back in the territory, it is natural to be upset, especially when we look around the country and see COVID surges everywhere. There may be a sense that finally, this is it. COVID has really arrived, and now it's just a matter of time before we look like so many other places down south. But there is no inevitability here. What happens next is entirely under our control. I have, not surprisingly, heard more cries of close the border. But what matters is not so much whether COVID cases enter the territory. What is much more important is how we prevent those infections from spreading to others. We cannot close the door entirely, but we can definitely reduce the risk of COVID advancing into Yukon. We have to live up to that responsibility to prevent spread of COVID. The actions that we all know how to do are proven to work. Let me now review a few of those public health actions again in a little more detail. Everywhere in Europe and North America, we're seeing the same thing, gatherings as a cause of COVID transmission. Everywhere down south, we're seeing social gatherings, weddings, and funerals as causes of ongoing transmission, leading to outbreaks and to more vulnerable people getting infected. So we must keep gatherings small. That is, to be clear, not a suggestion, but an order. Social gatherings must be no more than 10 indoors and 50 outdoors. Indoor gatherings that go outside the bubble must be spaced. Do not attend any social gatherings, no matter what size, if you have any symptoms at all that could be COVID, or if you're supposed to be in self-isolation, or you're a named contact of someone with COVID. Weddings are gatherings, funerals are gatherings. I talked last week about how risky funerals can be. On the website, you'll read the following. No more than 10 people can attend an indoor funeral service. No more than 50 people can attend an outdoor funeral service. Consider holding a service outdoors. Physical distancing can be easier if there's more space. Communal food and drink is not allowed at services for health and safety reasons. Please follow the guidelines and limit the numbers to the same as any other gatherings for these events. And I will come back specifically to Halloween parties in a few moments. So that's gatherings. Now let's look at another area of prevention. Stay home and away from others when you're sick. If you work, go shopping, go to school, or play sports with others while you're sick, you could be responsible for an outbreak. You could be responsible for people getting sick, going to hospital, being medevaced out, or dying from COVID. You could lead to services, workplaces, or communities being shut down. You could cause an outbreak that could overwhelm public health. All of these are very real possibilities. Through the advice I give to government or through the guidance that we provide, I'm not trying to make life more difficult for people. In fact, it's the opposite. I'm trying to help us get through this pandemic with as little damage as possible, but we must do the right thing. Stay home, stay away from others, and arrange to get tested if you are sick. It's that simple. So what else is there? Practice physical distancing at all times, that you are not within your household or social bubble. That's at work, on the playground, in the stores, in a lineup. If you cannot physically distance due to temporary crowds or poor spacing, put on a mask. If in doubt, put on a mask. Wearing a mask is good pandemic etiquette and shows that you care. Respect store or workplace policies that ask you to put on a mask. Do the right thing and show that you're being responsible and that you care for others. So what else is left in the Safe Six? Have we covered it all? By the way, check the yukon.ca website Safe Six section for a fun, new take on the new messages, on the same basic messages. But just to review, keep your distance, wash your hands, keep clean, and keep your space clean. Avoid crowds and stick to your social bubble. Stay away from others when sick. Travel wisely and respectfully, and self-isolate when you're required to. So Halloween, this is it, the last week of October, and with the bite of fall nights and a tinge of snow and the arrival of pumpkins in droves, it's certainly one of the most festive times of years. Scream-worthy decorations are going up, costumes are in production, pumpkin carving is reaching new heights of artistry. We know that Halloween will look a bit different this year as safe Halloween plans are organized, but that doesn't mean you have to miss out on the fun. Trick-or-treating can still be done if you take the proper precautions. As always, if you or your child are feeling ill, even with mild symptoms, please stay home. Although you may feel it's safe to trick-or-treat outside, it is not. If you are sick, please stick to your household otherwise. Any child going trick-or-treating should maintain their household bubble and go with a parent or sibling. Wearing a Halloween mask will not prevent you from passing on the virus. It is not necessarily the same as a non-medical mask, although you can accomplish both at once with some creativity. But distance rules apply regardless of your mask. This means 6 feet apart between all people who are not in your household bubble while you're out collecting treats. Going from house to house, as on the website, I encourage you to bring a broom or a sword or a hockey stick as part of your costume. This will allow you to knock 2 feet away from the door. And when knocking, do so gently. If you don't have one of these accessories while trick-or-treating, stand a few feet back and call out, trick or treat. That's the way I always used to do it anyway. When you're on the other end, handing out treats, there are a few things you can do to better follow the Safe Six guidelines. You can use tongs to hand out treats to kids. Avoid putting a communal bowl in front of your house. Remember to keep your interactions brief and maintain safe distancing from all trick-or-treaters. This is the year to get creative with your methods of handing out goodies. We've seen households rising to the occasion by creating candy shoots, Game of Thrones-inspired slingshots to give little Elsas or savvy baby sharks or brave knights their candy. Creating small individual packages with a few tidbits is also a way you can engage in safe practices. While the children are making last-minute adjustments to Halloween costumes, others would usually work on their own attire for annual Halloween parties. As Halloween falls on a Saturday this year, I'm aware of the temptation and have heard of many parties planned for this upcoming weekend. But I'm urging caution against participating in any Halloween parties this year. We must avoid any Halloween gatherings that are over 10 people, unless they are outdoors. And this weekend, I advise you to go one step further. Please limit any indoor gatherings to your household and social bubble only. Keep the rest outside. I understand that this is a weekend spent having fun with friends, but I urge you to keep the fun outside and spaced. There's evidence in the rest of Canada that some of the rising COVID cases were due to increased social gatherings over the Thanksgiving weekend in private homes. So please find an alternative to going to a crowded house party. Instead, watch a scary movie with your favorite goodies. Visit one of the local haunted walks. Take pleasure in handing out imaginative treats to the neighborhood kids, or hold a small outside gathering round a warm fire. Let's not jeopardize our good place with parties that can go off the rails and take us all with them. I ask all Yukoners who are planning to party to reconsider. Your participation may have severe consequences not only for yourself, but for all of us along with you. Think of all the life changes since March. Working from home, reducing our public outings, seeing friends in large gatherings, foregoing travel. It's been tough on all of us. COVID fatigue has proven to be a very real thing that most of us have or have experienced. Pandemic fatigue is something that evolves. We may feel okay one day, drained and exhausted the next. We want to see our loved ones, just for once, in person, rather than through Zoom or at a socially safe distance. But we can't give up. We have come too far to go back to what was considered normal before COVID became a part of our new normal. With the days getting darker and colder, we need to prioritize finding things that alleviate pandemic fatigue. If we let our guard down and pretend that it's not a threat, we will simply invite COVID in. There are ways to manage your COVID exhaustion. In a time where routines can be thrown out the window, attempting to establish a routine is one thing to introduce into your day-to-day. In an unpredictable time, daily rhythms provide a sense of stability and something to look forward to. Making sure you take time for yourself is also very important. If you have time on your hands, try out something new or revive an old hobby or pastime. What makes you feel good? If it's a walk around the block or clearing snow for your neighbor, or maybe checking out a new Canada Reads book or savoring a new recipe. Learn to do something new or talk to someone you haven't talked to for a while. Reach out and give someone a helping hand. Remember that a kind act is a boost for you as well. This has been a difficult week, but despite it all, we are still doing okay. We live in a wild and fiercely beautiful place, and we have each other. This week, we are one people with Watson Lakers, as much as we are all Yukoners. We've had some challenges, and we will, believe me, face some more. If we stay together, maintain our spacing and our connection and our kindness, take care of ourselves and each other, we will get there. We're slightly battered, but all the stronger, and we are still Team Yukon. That's all for my update. Thank you. Take care of each other. Stay well. Merci. Merci cho. Thank
you. Thank you, Dr. Hanley. Thank you, Premier Silver. We'll move now to the phone lines, and we'll begin with Nick Wells.
Hi, yeah, can you hear me?
Yes, we can. Go ahead, please, Nick. Maybe you can't hear us.
Nope. Now I can hear you guys. I'm just wondering if there's any concern about the cluster of cases spreading in Watson Lake, and if there's. I know that Dr. Hanley thought that there has been no other cases seen, but I'm kind of curious if the government's able to talk about the concern of the cluster spreading.
Yeah, of course there's a concern about its potential to spread, and that's so two things behind that. One is some of the contact investigations and testing is still being done as of today, so we're expecting more test results over the next couple of days, and by the end of the week, I think we will have completed testing on at least the people that we have identified as contacts and being more concerned about. But on the other hand, all of the testing, apart from the known cases that we've already announced, has been coming back negative. So that's all reassuring. But at the same time, this is an incomplete investigation. It does take several days to complete an investigation of a cluster. And as well as that, the reason that I emphasized testing of people regardless of the exposure, which is important to look at those dates and then think about whether you were there, regardless of that, anyone with symptoms, if they come forward for testing, it gives us another mechanism to assure that there has been, as I say, no escape of COVID into the community or anywhere else for that matter. So we never know for certain. I mean, part of the concern is this is why we do as careful an investigation as we can and as thorough an investigation as we can. So yes, I'm concerned, but so far the indications are positive for not seeing spread in the community.
Thank you. Do you have a follow-up question, Nick?
Yeah, the Premier, and it's slightly off topic related to the briefing today, but I'm curious, with this upcoming weekend and the time change happening in other provinces around the country, and the Yukon not adjusting its clocks this weekend, I'm curious if Premier thinks that the government is kind of prepared for, I guess, the headaches of dealing with a different time system than the rest of the country, or large parts of the rest of the country, rather.
Yeah, I'd say equally to that is Yukoners are ready to not deal with the headache of the circadian rhythms being all messed up. Dr. Hanley just spoke to that about our rhythms and patterns as we head into the winter under COVID conditions. One thing that we won't have to do is readjust our clocks. The government has been doing an awful lot of great work making sure that we've reached out to service providers, the international timekeepers, and all of these folks. We believe we're ready for it. It will be an adjustment, but again, one of the biggest surveys that we've had in Yukon history, with overwhelming support from Yukoners to stop messing with the clocks. And we also believe that BC is poised and ready to go as well. I know that they had bigger issues than to deal with this year, and so that paused what is already a legislative change in BC. So I would expect that to happen very soon for them to join us in not changing the clocks.
Thank you. We'll move now to Sarah Connors.
Hi there. I'm just wondering, it was mentioned that the Yukon government is working with Liard First Nation to address concerns regarding the virus. So just what are some ways that, the government is working together to ensure the safety of the First Nations? I'm just wondering, because I have spoken to some Liard First Nation citizens, and the people I've spoken to are pretty fearful of community spread.
Yeah, for sure. I mean, the communities that we've gone to, John Stryker, Minister Stryker, has done his community tours, starting with, do you want us to come to your communities or not? Do we do this by Zoom? If not, we're coming into communities to talk. It's definitely on everybody's minds, the fear of COVID. And what we've asked in every community is, if your fear is based upon the science and we can work together to make sure that we mediate any of your concerns, then we can work together. And what we've seen with the Liard First Nation and the new leadership there as well. Speaking to the chief the other day, well aware of the parameters, well aware of how his government can lend supports, including presence at the border. And we are working with Chief Charlie to talk about this, which is great. And what we hear from the chief as well is his concerns are based upon science and and willing to help out. And Dr. Hanley said it perfectly. We're all Watson Lake right now. We're all a community of Yukoners, but our hearts are in Watson Lake. Whether it's with the Mayor and Council, Chief and Council, the health department down there, the school. What we're seeing is a community coming together to make sure that we keep people safe. And I hold up the Liard First Nation for their efforts. The first thing that Chief Stephen Charlie told me was that he'd spoken earlier that day with Mayor Irvin. So, I mean, they're already in communication as governments down there, working hand in glove with the recommendations and guidelines from our government based upon Brandon Hanley and his team. So I'm really thankful for the strong leadership that we're seeing in Watson Lake.
Dr. Hanley?
I want to echo everything the Premier just said, and I have been in direct conversation with Chief Stephen Charlie since Friday, since the weekend, and through the weekend. So as with all the chiefs, I maintain a close relationship. I've spoken with several other chiefs since then, and I think there is nothing however we talk about COVID and try to prepare for it, there is nothing like the impact of having COVID in your community. So it's a shock. There's no doubt about it. It's a stressful time. It's also a time to show that to come back to what are the facts and what's the science and what's the best evidence. So knowing that we can be in control of this, and we have the means to be able to prevent spread and transmission, I think is a very powerful thing to remind ourselves of. And so I think a lot of our conversations are really about that. Okay, it's here. What do we do next, and how do we work together and follow the steps that we know work, and they work every time. So so I just echo that, and also that in addition to the First Nation, we have been also working directly and closely with the mayor and the CAO of Watson Lake.
Thank you. Do you have another question, Sarah?
No, that's everything.
Thank you. We'll move to Luke McGrath.
I have a question for Dr. Hanley. I spoke to the mayor of Watson Lake yesterday, and he had mentioned that, at least in the grocery store, which was identified as one of the exposure sites, that they've increased a bit of the preventative measures. A lot of people are wearing masks now. There's lines sort of directing people where to go and where to stand. Do you know if any of the other businesses in Watson Lake have just increased their preventative measures a little bit and their safety measures?
My understanding, I can't tell you directly for the home hardware store, and I think a direct conversation, if you were to reach out directly, I'm sure they'd be happy to talk to you. My understanding is that the Big Horn Motel is actually closed at the moment, and closed really for logistical reasons at the moment. So I'm quite sure that this is going to give the staff, the very capable staff, and very dedicated staff, I might say, a chance to refresh and review their protocols and look at for what they can do better. As this is not just about these three businesses, and I think it's really important to emphasize that this is maybe a gift in a way to all of us to look at what are our practices as citizens, as businesses, as business owners, as workplaces. So again, I think it's we need to focus on these particular locations because of the exposures, but not as sort of these isolated examples of perhaps not having followed protocols completely. It's really what can we learn from these cases to improve our preventative practices from here on and move on.
Premier Silver?
And, we've been calling it somewhat of a wake-up call. I wouldn't say necessarily a wake-up call. The guidelines are already there. People already know what they're supposed to be doing. But what happens in these situations is people do up their games, and that's what we heard from the mayor. And I'll add from the conversation that I had with Chief Charlie, his initial response right away was a day to shut down offices and sanitize. Again, going above and beyond the guidelines. And in his perspective, it was to show the public servants in his government how important safety and health is to him in his leadership position. And then we went into a conversation about the balance that we have to share as leaders in providing safety from COVID, but also the mental health of individuals that work in these government offices or in grocery stores or the like. So it was really good to hear both what Dr. Hanley was just saying from his conversations, but also in our conversations in leadership in Watson Lake. Not necessarily a wake-up call; they were already awake, but definitely stepping up their game to make sure that the safety of people in Watson Lake is the number one concern.
Thank you. Luke, do you have a second question?
I do not. Thank you.
Thank you. We'll move to Haley. Are you still there, Haley? We'll come back. We'll move now to Philippe Morin.
Yes, hello. Dr. Hanley, you had mentioned previously that Yukon has some rapid testing machines. We only have a few of them. Were those used in Watson Lake?
Yeah, yes. We only have one rapid testing machine currently online. So the rest are in the process of acquisition. For instance, the Abbott ID machines, which are a potential tool for us to use, but we're not there yet. So the Gene Expert is the machine that is the analyzer that's in place and at Whitehorse Hospital, and that's not a machine you move around. That's a kind of a fixture at the lab, but it does allow us to take advantage of that more rapid turnaround when we need it. So for example, some of the Watson Lake testing was over the weekend carried out on the Gene Expert, and some of the testing today and tomorrow is also on the Gene Expert. There is still a process of quality assurance, so any test currently done on the Gene Expert is also done as a quality check in BC. But we're definitely using that, and then sort of doing a triage as to what goes, what is tested here versus what is sent out. I will say that we are continuing to see very good turnarounds, though, from our BC testing, and some of the tests that we had over the weekend actually tested in Watson Lake and resulted in a day and a half from the BC labs.
Thank you. Do you have a second question, Philippe?
Yes, just to clarify, out of Watson Lake, is material being flown out? Is that how tests are being sent for testing?
No, actually it's been by road. The testing with drivers has been from Watson Lake by road to Whitehorse, and then sent out by the usual routes, which is the flights out from Whitehorse. And of course, I'm not saying a day and a half is the expectation from now on. That was really all of the stars aligning to show how well it can work when the road transport aligns with the shipping times out, and then once at BC CDC lab, despite the high volume of testing in BC, and they have had, they certainly have, they have faced some hitches in testing turnaround in BC, but once at the lab, the turnaround time continues to be very good.
Thank you. We'll move to Laura Howells.
Hi there. A question for Dr. Hanley. I wanted to ask about the time delay in publicly reporting these cases. You mentioned you'd found out about the first cases in Watson Lake on Thursday night, but there wasn't a press conference until after 5 on Friday, and then on Monday, I know you announced some new cases live on CBC Radio with my colleagues, but there wasn't a press release from the government website until much later that day. Why has there been such a delay in formally sharing this information about new cases with the public?
So it's, the reason is that there's always going to be a lag between when we actually learn of the results. So in this case, for instance, the Thursday night, like late Thursday evening, was the first result. Now, we do not carry contact tracing out at night or during the night. It's not night shift work. We need our team on the ground and sustainable and preserved. A small team of skilled nurses that do contact tracing. So that begins first thing really in the morning. And then what we need the information before we publish information about cases, including whether or not a public exposure notification is required. That takes some investigation. It takes talking to people, sometimes talking to them several times, finding them, of course, getting the story, corroborating one story with another, and then building a picture of what is actually going on to inform what we need to tell the public. Because remember, what we need to tell the public is what is the risk and where is the risk. And clearly that takes time to put together in a reliable way, in a coherent way, in an understandable way. I think really to have under 24 hours from learning of cases to a reasonable amount of information for the public to know what's going on and what the risk is and where the risk is not is actually a pretty good turnaround.
Thank you. Do you have a follow-up question, Laura?
Yes, thank you. I'm wondering if your advice will change on traveling between communities.
I'm not anticipating changing advice. So again, the advice that I have on traveling between communities is to respect community wishes, to travel wisely, to travel with respect, and otherwise to to follow the other Safe Six measures that are kind of part of that package. So if the question is regarding the Watson Lake cases and the exposures, no, there'd be I have no reason to change travel advice based on this recent cluster of cases.
Thank you. We'll move to Gabrielle.
Hi. I know in BC and possibly in other jurisdictions as well, you can check your COVID test results online and often get a faster result that way. Are there any plans to move to online test results here?
Yeah, it's a good question. I think it's something that we obviously have noted. It's something that takes a lot to set up successfully, a lot of infrastructure and a lot of time investment. So I would say it's on the table, but we are very concerned about giving the results in the right way, and the whole process of I mean, you might think all I need to know is whether it's positive or negative, and that's part of the story, but it's not the whole story. The real story is around, okay, what do I do now? What do I do with that information? And that's why the kind of personalized system we have now with skilled nurses giving the results and along with the advice about what to do. And it could be, for instance, someone who is highly suspected to have COVID, who has a negative test, but has to continue in is going to be advised to stay in self-isolation for another test because maybe the first test was done early in the infection and maybe negative, but misleadingly negative. So it's all around the circumstances of why the test is being carried out, and then what the instructions or advice is after that. So it's hard to reproduce that by simply phoning up and getting a negative test and potentially having misleading information to go on. So right now, what we have is a gold standard in quality of results. And I'd say if we, looking at sort of other ways is something that we're very much interested in. Should we need to get to that higher volume of resulting, then we have to look at other ways of maintaining turnaround time and efficiency of results. But for the moment, I think we have a very good process in place that suits the circumstances of our territory.
Thank you. Follow-up, Gabrielle?
Hi, yeah, I'm wondering if perhaps you could speak to some parents who are concerned and are hearing your advice, but are really just wondering why not just put on more restrictions? Why not just be really safe around Halloween versus, allowing trick-or-treating to go on?
What the guidance that we have produced is guidance that we feel very confident about is safe. But of course, it depends on the parent and it depends on the family. And some parents may just not feel comfortable with trick-or-treating, and that's perfectly fine. And this is a COVID year. Everything's different this year. And any family that doesn't feel comfortable should not feel pushed or coerced into doing something that they don't feel comfortable with. And there are a number of other activities that we have suggested as part of the Halloween guidance on the website about other ideas. And maybe that's a bit of a group discussion amongst parents, but I feel very comfortable with the advice that we put out and with the safety that we've built around the advice that we give. So really from here on, it's really a matter of choice.
Thank you. We'll move now to Lorraine, Radio-Canada. Lorraine?
There's a miscommunication there. Philippe Morin from CBC. I've already asked my question.
Okay, no, sorry, I'm looking for Lorraine from Radio-Canada. If not, we will thank everyone for their time today. Our next COVID-19 update will take place Wednesday, November 4th at 11 a.m.